Do it right, and do it right the first time. That's what I was taught growing up. Those are my German roots. That's who I am. And it has served me well in medicine. It has also nearly destroyed me. Hello, I'm Dr. Felix Boecker, and today we're talking about perfectionism, the thing that gets you into medical school, and the thing that might kill you once you're there. Welcome to In Search of 42. Here's the paradox of perfectionism in medicine. You need it to succeed. You need high standards. You need attention to detail. You need the drive to get things exactly right. Because you're dealing with people's lives. Mistakes have consequences. Errors can be fatal. So perfectionism is essential. But perfectionism is also destructive. It creates impossible standards. It makes you chase goals you can never reach. It turns you into a hamster on a wheel, running forever toward a destination called perfect that doesn't exist. And when you inevitably fall short, because you will, because you are human, perfectionism tells you that you have failed, that you are not good enough, that you should have done better. And that destroys you mentally, emotionally, physically. So, how do you manage it? How do you maintain high standards without destroying yourself? How do you strive for excellence while accepting that you're human? That's what we're talking about today. Let me tell you about my perfectionism. Yes, I'm a perfectionist. Some of that comes from my German roots. Do it right and do it right the first time. That's what I was taught. That's the cultural expectation. Germans are known for precision, for quality, for getting things right. And I absorbed that. I always want what's best and what's right for my patients. There is no compromise. Do it right and do it right the first time. I think my perfectionism comes more from my personality and German roots rather than from medicine. It was there before medical school. It's part of who I am. Medicine didn't create it. Medicine just gave it an outlet. And if anything, medicine has made it worse. Understanding where my perfectionism comes from helps me manage it because I know it's cultural. I can see it as something separate from myself, something I learned, not something innate. But it also makes it harder because it feels like part of my identity. It's not just I'm a perfectionist, it's I'm German and Germans do things right. That is harder to let go of. But let me be clear about something. Perfectionism has served me well. It got me through my education. It has made me a better surgeon. It was never good is good enough. It was always do it right and do it right the first time. Learn from your mistakes so you can get it right the next time. That drive, that standard, that refusal to accept mediocrity, that's what has made me successful. That's what got me through organic chemistry. That's what got me through the MCAT. That's what got me into medical school. That's what got me through residency. That's what has made me a competent surgeon. When you're operating on someone, when you're holding a scalpel, when someone's life is in your hands, you need perfectionism. You need to care about every detail, every suture, every decision, every step, because mistakes matter. Because close enough isn't good enough. Because people die when you don't get it right. So, perfectionism is essential. It's a strength. It's what makes medicine excellent, and I am grateful for it. But perfectionism has also hurt me badly because life isn't black and white. It's almost always a shade of gray somewhere in between. But perfectionism demands the world to be black or white, right or wrong, perfect or failure. There is no middle ground. And that's where the damage happens. Perfectionism hurts your mental health. It can lead to burnout because you are constantly chasing a standard which can never be reached, like a hamster on a wheel. You will never reach your destination of perfection. You will just keep running, exhausted, depleted, never satisfied. I hold myself to impossible standards. I always want to do what's right, which isn't always the same as the best for a given scenario. For example, a total contact cast is best for diabetic foot ulcers. That's the gold standard. That's what the evidence says. But maybe the patient is about to travel or attend a big event or has an event where the cast would be bothersome or intrusive. So even though it's the right thing to do medically, it's not necessarily the best thing to do for that patient in that moment. But perfectionism doesn't accept that nuance. Perfectionism says you should have put the cast on. That's the right treatment. And when I don't, when I make a pragmatic choice, perfectionism tells me that I have failed, that I have compromised, that I have done less than the best. Perfectionism is an impossible standard which I can never meet, which then leads to worsening depression because I'm always falling short, always not good enough, always should have done better. That's exhausting. That's destructive. That's what perfectionism does when it is unchecked. Let me tell you about a gentleman with a recurrent inguinal hernia. This was when I was a chief resident. He was my patient, my responsibility. What was supposed to be an easy surgery, a routine case, well, it went wrong. He lost one of his testicles. He had a large open wound in his groin that never fully healed while I was still at Abington. I feel like I failed him in many ways. Even though I had an attending surgeon overseeing my entire care, even though complications happened, even though I did everything by the book, I still feel like I failed. That's perfectionism. That's the impossible standard. I wanted what was right for the patient to get his hernia fixed, but that's not what happened. And my perfectionism tells me that's my fault, that I should have done better, that I should have prevented the complication, but that's an impossible standard to uphold. Medicine is about people, and people are messy in a figurative sense. Biology doesn't always cooperate. Complications happen despite perfect technique. Bad outcomes happen even when you do everything right. You cannot control everything. But perfectionism doesn't accept that. Perfectionism demands that you control everything, that you prevent every complication, that every outcome is perfect. And when it's not, well, you failed. That's the impossible standard. And I still carry that case in my graveyard, even though intellectually I know I did everything I could. Emotionally, perfectionism tells me I should have done better. Here's the thing about perfectionism in medicine. Medicine selects for perfectionists. The people who get into medical school are perfectionists. They aced every test in college. They got perfect or near perfect MCAT scores. They have flawless transcripts. They volunteered and researched and shadowed and excelled at everything. They are high achievers. They are perfectionists. That's who succeeds in the pre-med competition. That's who gets admitted. So medical school is full of perfectionists. And then medical school makes it worse. Because suddenly you are competing with other perfectionists. Suddenly you are not the smartest person in the room. Suddenly you are average or below average. And for someone who's been perfect their entire life, that's devastating. For many medical students, medical school is where they experience their first major setbacks, their first academic failures, their first time not being the best. And perfectionism doesn't handle that well. Perfectionism is especially prevalent in procedural specialties like surgery, interventional cardiology, interventional radiology, orthopedics, any specialty where you have to get it right the first time because you can't go back and fix it later. Doing a hip replacement, for example, leaves no room for error. You can't just go back in again to fix something. You have to get it right the first time. The alignment has to be perfect. The sizing has to be perfect. The technique has to be perfect, or the patient suffers. So, procedural specialties attract perfectionists and they reinforce perfectionism because the stakes are so high, because the margin for error is so small, because close enough can mean chronic pain, disability, or even death. That's not wrong, that's appropriate, but it's also exhausting because you can't be perfect all the time. And when you inevitably make a mistake, perfectionism destroys you. Here's what happens to perfectionists in medical school. In order to survive, you have to strive for perfection. You're dealing with other people's lives after all. But in order to survive, you also have to realize that it is an impossible and unrealistic standard to uphold. You cannot ace every test. You cannot save every patient. You cannot know everything. You cannot be the best at everything. Getting into medical school is competitive, and it is only in medical school that physicians in training will have their first major setbacks and academic failures. That first failed exam, that first bad evaluation, that first patient who dies despite your best efforts, that first time you don't know the answer and get humiliated on rounds. Perfectionism is what got them there, and it will help them succeed as long as the perfectionism doesn't consume them, as long as they can learn to accept failure as part of learning, as long as they can develop resilience instead of falling apart when they're not perfect. That's the balance, and not everyone finds it. Let me talk about morbidity and mortality conferences, M&M for short. These are held in academic surgery programs. The purpose is to review cases where there were complications or deaths, to discuss what went wrong, to learn from mistakes. It's supposed to be educational, but it's also institutionalized perfectionism. You stand up in front of all your colleagues, all the attendings, all the residents, and you present a case where something went wrong, where a patient died, where there was a complication, where you made a mistake. And then you get grilled publicly, sometimes harshly, about what you should have done differently, about how you should have prevented the bad outcome, about how you failed. The stated purpose is learning. The actual effect is reinforcing perfectionism, reinforcing that mistakes are unacceptable, reinforcing that bad outcomes are your fault, reinforcing that you should have done better. Now, some M&M conferences are constructive, but many are punitive. Many are about public shaming, about making sure you never make that mistake again, by making you feel terrible about it. That's institutionalized perfectionism, and it's damaging. Here's something important. Good enough can exist in medicine. There are lots of times when there isn't one right approach, just the approach that works best for the given situation. For example, an inguinal hernia can be repaired in the traditional open way or laparoscopically. Either way repairs the hernia. The outcomes are generally the same between the two. It's just a matter of which approach you are more comfortable with that creates the best outcomes for the patient. Another example, a bleeding spleen can be controlled surgically, can also be controlled by interventional radiology. Now, IR usually has less morbidity associated with it, but either can be acceptable in many clinical situations. Some surgeons prefer the old school way of removing the spleen entirely. Others use surgery as a plan B when IR intervention fails. As long as someone has reasonable justification for their approach, that's okay. That's good enough. There isn't one perfect way. There are multiple acceptable ways. And accepting that is essential for managing perfectionism. When I first became an attending, I tried to give residents some opportunities to make decisions. As long as it was clinically sound, I would let them run with it. It did feel weird and uncomfortable at first because my perfectionism wanted them to do it my way, the right way. But I also realized it was important for their learning process. They needed to make decisions. They needed to develop their own judgment. They needed to learn that there are multiple right answers. Nowadays, I am much more open minded. I try not to see the world in black and white anymore. Especially if the outcome is the same, it doesn't matter what the route is that we took to get there. It's just a journey. From my way is the right way to multiple approaches can be equally valid. It still feels uncomfortable sometimes, but it's healthier, it's more realistic, it's less perfectionist. Let me talk about the connection between perfectionism and depression because they are deeply intertwined. I have depression. I've struggled with it for years, and perfectionism plays a role, a significant role, because I hold myself to impossible standards, standards that I can never meet. And when I inevitably fall short, I feel like a failure. I criticize myself. I beat myself up. I tell myself I should have done better. And that feeds the depression. The perfectionism says, you're not good enough. The depression says, you'll never be good enough. And they reinforce each other. It's a vicious cycle. Perfectionism creates the impossible standard. Depression amplifies the self criticism when you don't meet it, which makes you feel worse, which makes you try harder to be perfect, which means you fall short again, which makes you feel even worse. Round and round until you're exhausted and depleted and convinced you're a failure, even though you are not, even though you're doing your best, even though you are human and humans cannot be perfect. That's the connection between perfectionism and depression. And it's dangerous because it can lead to burnout. It can lead to leaving medicine. It can lead to suicide. Perfectionism kills physicians. Not directly, but through the depression and hopelessness and exhaustion it creates. So, where's the line? Where's the line between healthy high standards and destructive perfectionism? How do we know when we've crossed it? Here's my answer. When it starts to interfere with you trying to reach your goals in life, if your perfectionism is driving you to excellence, that's healthy. If your perfectionism is driving you to exhaustion and misery, that's destructive. If your perfectionism makes you better at your job, that's healthy. If your perfectionism makes you hate your job, that's destructive. If your perfectionism pushes you to learn and grow, that's healthy. And if your perfectionism makes you feel like a failure all the time, well, that's destructive. If your perfectionism helps your patience, that's healthy. If your perfectionism prevents you from being present with your patients because you're obsessing over details, that's destructive. The line is individual. What's healthy for one person can be destructive for another. But if you're asking yourself, is my perfectionism a problem? The answer is probably yes. Because healthy perfectionism doesn't make you question it. Destructive perfectionism does. So when someone comes to me with destructive perfectionism, here's how I help them. Step one, recognize that perfectionism is an impossible standard. You cannot be perfect. You are human. Humans make mistakes. That's not a flaw. That's reality. Accepting that is the first step. Step two, realize that sometimes good enough is indeed good enough. Not everything requires perfection. Some things just need to be done. Some things just need to be adequate, and that's okay. You don't have to optimize everything. Step three, make concessions somewhere. You cannot be perfect at everything, so decide where you're going to accept good enough. Maybe it's housework. Maybe it's certain administrative tasks. Maybe it's some aspects of your job that aren't critical. But choose where to let go of perfection. Step four, separate your worth from your performance. You are not your outcomes. A bad outcome does not make you a bad doctor. A complication does not make you a failure. You are worthy regardless of your performance. That's hard for perfectionists to accept, but it's essential. Step five, practice self compassion. Talk to yourself the way you would talk to a friend. If a colleague had the same complication you did, would you tell them they're a failure? No. You would tell them complications happen, that they did their best, that they are still a good doctor. Give yourself that same compassion. Step six, challenge the black and white thinking and look for the gray, look for the nuance, look for the multiple right answers. The world is not binary. Medicine is not binary. There are many ways to do things right. Step seven, accept that you cannot control everything. You can do everything right and still have a bad outcome. That's medicine. That's biology. That's life. You can only control your decisions and your effort. You cannot control the outcome. Accepting that is essential. So let me tell you about my journey with perfectionism. It's still a work in progress. I'm definitely more open to accepting strategies now other than my own. But it's not easy. It doesn't come naturally. I have to work at it. I have to remind myself that multiple approaches can work, that my way isn't the only right way, that good enough is indeed good enough sometimes. The spleen example I mentioned earlier, that's been part of my growth. Learning to accept that surgical management and IR management are both valid. That I don't have to do it my way. That as long as the outcome is good, the route doesn't matter. That still feels uncomfortable sometimes. Part of me still thinks, no, my way is better. But I have learned to quiet that voice, to recognize it as perfectionism, and to choose a different response. I have also learned to give myself grace when things don't go perfectly, when a patient outcome isn't ideal, when a wound doesn't heal as expected, when something goes wrong. I still feel the perfectionism. I still feel like I should have done better. But I can recognize it now. I can say that's my perfectionism talking. And I can choose to respond with self compassion instead of self criticism. That's progress. It's not perfect progress, which is fitting, but it's progress. So, if you're a medical student or resident, listen carefully. Your perfectionism got you here. It's a strength, but it can also destroy you. You need to learn to manage it now before it consumes you. Here's what I want you to know. You will make mistakes. That's how you learn. That's how everyone learns. Making a mistake doesn't mean you're a bad doctor. It means you're human. You will have bad outcomes. Not every patient can be saved. Not every treatment works. That's medicine. That's not your failure. You will not be the best at everything. You will be good at some things, average at others, and that's okay. You don't have to be the best. You just have to be competent and caring. You will disappoint people sometimes. Your attendings, your patients, yourself. That's inevitable. That's not a reason to give up. Learn to separate your worth from your performance. You are not your test scores. You are not your evaluations. You are not your patient outcomes. You are a human being with value, regardless of how you perform. And please, please practice self compassion. Be as kind to yourself as you are to your patients. Be as understanding of your mistakes as you are of theirs. Be as forgiving of your humanity as you are of theirs. That's how you survive medicine with your mental health intact. So here's the balance. Strive for excellence, not perfection. Excellence is achievable. Excellence is sustainable. Excellence allows for humanity. Perfection does not. Maintain high standards, but realistic ones. Standards you can actually meet. Standards that make you better without destroying you. Care deeply about your patients and your work, but don't let that care turn into self destruction when things go wrong. Learn from your mistakes, but don't let them define you. Push yourself to grow, but don't push yourself into the ground. Be the best doctor you can be, not the perfect doctor, because the perfect doctor doesn't exist. And trying to become something that doesn't exist might just kill you. That's balance. Excellence without destruction. High standards without impossible standards. Care without self flagellation. Growth without burnout. That's what we're aiming for here. Here's what I want you to take away. Perfectionism is both a gift and a curse in medicine. It's what makes you excellent. It's what makes you care. It's what makes you strive for the best. But unchecked, it will destroy you. It will create impossible standards. It will make you miserable. It will feed your depression. It will burn you out. So you have to manage it. You have to recognize when perfectionism is helping versus hurting. You have to accept that good enough is indeed good enough sometimes. You have to practice self compassion. You have to separate your worth from your performance. You have to accept that you are human and humans make mistakes. Humans have limitations. Humans cannot be perfect. That's not a flaw, that's reality. And accepting that reality is how you survive medicine, with your mental health intact, with your passion still alive, with your humanity preserved. Strive for excellence, not perfection. That's the key. I'm a perfectionist. It's part of my German roots. Do it right and do it right the first time. That perfectionism got me through medical school. It has made me a better surgeon. It's a strength. But it has also hurt me. It has created impossible standards. It has fed my depression. It has made me carry cases in my graveyard that I should have let go of. I'm learning to manage it. to accept multiple right answers, to give myself grace, to recognize that good enough is indeed good enough sometimes. It's a work in progress, but it's progress, and that's what matters. Not perfection, progress. This is In Search of 42. I'm Dr. Felix Boecker, and you don't have to be perfect. You just have to be human and keep trying. That's enough. If this episode resonated with you, hit that like button and subscribe. Leave a comment about your experience with perfectionism. How has it helped you? How has it hurt you? How are you managing it? Also, let me know what you want me to cover next, and I will see you in the next episode.